Hi everyone. Thank you for all your support. Your support is our inspiration. If any of you are watching our video without subscribing us, kindly subscribe us, like us, share us. So today I am here for wound assessment and ANTT. So wound assessment and ANTT is a combined procedure, but it's considered as two skill station. So wound assessment it's considering as a one skill station. ANTT is another skill station. Altogether, it will be 21 minutes. So it will be dividing. If you are doing wound assessment and ANTT in a first attempt, it will be altogether considering as a 21 minute. So you will be doing the wound assessment, then you will be going for the ANTT. It's a continuous procedure. But if you failing any attempt, if you pass on the wound assessment or you fail on the ANTT, or if you fail on the pass on the ANTT and fail on the wound assessment, in that case it will be dividing as wound assessment is a 6-minute procedure and ANTT is a 15 minutes procedure. Otherwise, it's altogether 21 minutes. Hope you all are clear. So in wound assessment, you will be getting it's not a real patient, it's a mannequin, and you won't be getting a wound. Either you will be getting a picture like this, or you will be getting a wound like this, and over there they will be showing that one. So whichever it will be, you need to assess as it is a real wound. Accordingly, you need to assess it. Then each of the things you need to verbalize as well. Then once you assess the wound, you will be going to arrange the equipments for the ANTT. Okay. I'm focusing for the wound assessment and ANTT. So I'm not focusing initial parts. If you having any of the doubts, please watch my other videos for the safety check and rest of the things. So I will be starting from the explaining the procedure. So consider we done the safety check. First hand gel, introduce yourself, allergy check, pain check. So that's been completed. Okay. So now you starting with the explaining the procedure. As I always say, I'm focusing to the camera. That's why I'm focusing to you. Always make sure you focus to the patient. Okay. So okay, Joe. I'm here to check your wound. So once I assess your wound, I will be going and arranging the article for dressing your wound. Is that all right? It won't be a painful procedure, but it might be a little bit discomfort as well. As you said, you already you haven't got much pain. So if you're in pain, I will give you the pain medication. Is that all right? So is that okay? Can I go ahead? Okay, that's fine. Thank you, Joe. So I'm just going to gel my hands. So focus, complete your step. So I'm waiting for dry my hands. Now I'm just taking the apron. Okay. I'm wearing my apron. So I'll make sure I will there is no fan, and I will close the windows and doors. So I'm just closing the curtain as well. So I'm not closing the curtain fully so that you will be able to watch the video. Otherwise, make the privacy always. Okay. And I'm using my glove as well. Okay, Joe. Joe, I have already given you privacy. Is that okay? Can I check your wound? Am I okay to expose you a little bit? Okay. So expose only the minimum what you needed. That's fine. Okay. I can see that it's a surgical wound, and I need to count the stitches. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. There is 12 stitches. It's around 1, 2, nearly 4 centimeter long and nearly 1 centimeter wide. Um, there is no, the edema. I can soon see the wound site is slightly red, but it's closing together. All the edges are equal and they're closing equally. There is no pus or any exudate. There is no leakage. So wound look healthy and clean. The surrounding is, there is no swelling, slightly redness in there, but there is no swelling. Joe, if I press your surrounding, just let me know if you are in pain, okay? Is there any pain? No? Okay. Is there any pain? No, that's fine. And is there any pain? Little bit, yeah? Okay. I can see the wound is, there is no swellings and the patient is not complaining much pain, just around. So the wound condition is looking good, and it's started to healing. The skin look, the area look pink and healing. There is no pus or exudate. So I don't need to send any culture to the lab. I'm not going to take any swab as I can see that there is no sign of infection. I'm not going to refer at the moment because I can see that the wound is looking clean and it's healing. So that's fine. But we still need to dress every day until it's completely healing, and maybe we can do the alternate day once it's started better. So okay, Joe, I'm just covering you. So remove the apron and glove. Gel your hands again. Okay, Joe, as I said, I'm going to arrange all the equipments for the dressing. Is that all right? Are you comfortable still? Okay, that's fine, Joe. As soon as I arrange all the articles, I will be come back to you. Here is your call bell. You can press the bell if there is anything. And I'm just nearby only. Is that all right? Okay, thank you, Joe. Now, you need a trolley like this for ANTT. So now I need to clean the trolley. Before that, I need to gel the hand again. So in ANTT, it is really important, how many times you need to do the hand gel, okay? So do the hand gel. Get another apron and wear the glove. So always make sure you check the C shape, that is your for the head, okay? So wear your apron. And wear your glove. Now you need to use the cleanile wipes. So that is your cleanile wipes. You need to check the expiry. So it expires 2026 February 25th February 2026. So you need one wipes for the top trolley. So make it as open fully so that it will be cover all the area. Okay. Do cleaning in zigzag motion. Okay. Then do the cleaning from the farthest to nearest. Now move like this. Then you just do the farthest, nearest. Once you're done there, move like this. Then farthest, then nearest. Then you just need to discard that one in the clinical waste. Take a new one. Now you need to do the down trolley. So make sure do like that so that it won't be bent anywhere and it won't be touching anywhere on your this one. Okay. So make sure you clean the farthest in the zigzag motion. Farthest, then nearest. Move like that. Then so once you complete it, move with that one. Try not to touch anywhere you already cleaned. Now you can remove your apron and glove. Gel your hands again. All your equipments needed, you need to arrange on your bottom shelf. Okay. So you need a dressing pack. So dressing pack is intact. The expiry date is March 2026. So it's intact and in date. So I can use that one. I need a chlorhexidine wipes, 2% and 2% chlorhexidine and alcohol wipes. That is called equipment wipes. Okay. It's expiry February 2026. So it's in date and intact. And you need a dressing, Mepo dressing. So that's the one. So that also the expiry date is 2026 March. So it's in date and intact. And you need a non-muscle. So you need to check that is there any precipitation. It's clear and it's no precipitation. And the expiry date is January 2025. So it's in date and intact. Keep that hand gel there. And you can keep your glove pack as well. So if you needed the glove, you can use that one as well. Okay. All your equipments are on your bottom trolley. If you are outside your curtain, you are arranging all the articles from outside the curtain, always make sure either you can keep the one more apron on your trolley, or you can wear the apron, but you need to come without touching the your curtain. Okay. So always make sure you should come with the minimal disturbance of the curtain. Okay. As I am doing everything from near to the patient, so I will be able to wear the apron from here itself. Okay. Otherwise, you can wear the apron once you reach to the patient side as well. So I am wearing the apron from here. Okay. Okay. Now you can gel the hands again and come to the patient. So make sure you touch on the middle of the trolley and bring that like that. Come to the patient. Okay, Joe, I'm back with all your equipment. Are you comfortable there? Am I okay to proceed? Okay. So make sure you arrange the trolley convenient for you. Okay. So gel the hands again. So you need to take the dressing pack. You need to arrange the dressing pack on the top trolley. So always make sure you will be able to see from the back side. It's there is a black indicator there. So from that side you can open like this without touching the inner part, and without touching the outer part covering on the trolley as well. You can place the dressing pack like this and not upside down. So this is the way. Okay. Now you need to gel the hands before touching the dressing bag. Now need to touch the dressing pack only the outer part. So do not touch the inside of the dressing bag. So always make sure pinch the dressing bags. So use both the hands, okay, and always make sure, like, if this one is the green one, you might be getting the blue one over there. So accordingly, you just need to think that the outer covering, always the inner covering will be the white part. So always make sure the inner part shouldn't be touched anywhere on the outer side of the trolley. Okay. So always make sure while you're opening, is any of the white part is coming. So you need to pinch like that, and you need to arrange accordingly. So this is the main part of the ANTT, how to opening your dressing bag. So wherever you're not able to, you just need to pinch like that. Then you just need to open like this. Okay. So now almost your dressing bag is nearby there. Now you need to arrange the dressing bag correctly. Before that, you need to gel the hand again. So now you can touch only the edge of this orange bag. So you can just touch on the edge one. Now you need to your dominant hand go inside, and always make sure this should be open just on the dressing bag itself. Try to close like this so that it won't be going anywhere. Now you need to arrange your dressing bag. Okay. So make sure you can take out everything, and while it's a complete sterile now, you will be able to touch anywhere. So make sure you straighten all your dressing bag correctly like this, but make sure your orange part is not going outside the sterile field either. Okay. So arrange everything correctly. Take out everything from the dressing bag. So you can leave maybe 1 or 2 gold pieces inside so that it won't be splash out while you are adding the normal saline there. Make sure you can take out the glove also outside so that it will be easier for you to arrange taking your glove. So if you can leave that in the front, fine. Okay. Now you can attach this on the trolley. I will show you that how to take if it is a closed wound. Okay. So now I am showing you the how to doing the open wound. You can just do that one. So now you will be able to touch anywhere. You can attach this one to the side of your trolley. Now you will be able to use this one for your bin. Okay. So that will be easier for you to use as a bin bag. Okay. So make sure it can be wide open so that it will be easier for you. So arrange everything correctly. Now most of your things are in. Now you need to arrange the rest of the articles. So before that, you need to do the gel hands again. So make sure gel hands do the proper procedure. Okay. So now you need to clean the normal salt and add that in the for the dressing bag. So always make sure the black end indicator is there. That part you need to be cleaned. So open it, clean for 30 seconds, 28, 29, 30, and wait for another 30 seconds for dry. So now it's dry, 28, 29, 30. So open it for, now you need to pour it very carefully without touching and without splashing. Get the hands again. Now the last one from your trolley, that's your dressing. Always make sure very carefully open it and drop it. That's it. So now all your equipments are there. So now you can prepare the patient Okay, Joe. Am I okay to expose you a little bit? I already given you privacy. Are you okay to go ahead? Okay, that's fine. So I'm exposing you a little bit. This time you will be getting a open wood. So they will show you that somewhere there will be the dot or something will be there. So accordingly they will say that that is your wood. You can open, you can press that one. Okay. So just you just need to expose a minimal whatever how much the area you needed, but always make sure that when you are folding it, fold it correctly so that it won't be coming back to your the area as well. Okay, so the patient is prepared now. Now everything is okay, so I can just wear the sterile glove. So always make sure the first one you need to touch inside. So that means this will be going inside of your hand. So take that one. So always make sure from inside, and with this glove you will be, because it's sterile, you will be able to touch anywhere, but always make sure while you are inserting, you need to touch the outer part. Okay, now you are ready. So you can prepare the area with your draper. So always make sure cover your hand with the sterile field. Okay. Joe, will you be able to lift your leg up? Okay, thank you. So if you are doing like that, the examiner will be come and help you, or you will be able to attach like that. So now you haven't touched anywhere on your hand. Okay. So now you can keep one hand as a sterile and one hand as a clean. So always make sure the sterile hand always should be on the sterile field. So now we need to take one gauze piece. Squeeze it and drop it like that. Now you need to clean from the less contaminated area to more contaminated area. One stroke and one more. The same one stroke. So now you can see that Joe, your wound is clean, and I don't need to do any more cleaning. So I'm just going to dry it. Put the patch dry. Done. Now you will be able to take the your dressing. So it will be better. You can open it with a one end with one hand. Now it's ready. Joe, I'm just going to stick the plaster on you. Okay. So now you will be able to use the back hand of the other hand, and without touching the inside. Okay. So now the dressing is completed. Completed your dressing. Okay. I'm just going to cover you. Are you in any pain or anything? Are you comfortable there? So now you need to take out everything. This one, and you will be able to take out your gown and gown as well. So now I need to gel my hands. Okay, Joe. As I said, I have done your dressings. Your dress, the wound looking clean and healthy, and it's healing as well. So we will see that tomorrow as well. and if needed, we will do the everyday dressing, unless we will make it as a native. I will document the same in our nurse's note. Are you comfortable? Are you in any pain? Do you need any pain relief? Okay. So are you comfortable there? Do you have any questions? Okay, that's fine. So I'm just going to dismantle all the articles and I'm going to wash my hands. Thank you everyone for watching my video. So I will dismantle all the articles and I will be washing my hands. Thank you everyone for all your support.